calling up the panelists. I'll be calling up the panelists, and please let's clap for them, welcome them. Peter Oshikoya. All right. We also have Dr. Please forgive me. I'll try my best to pronounce this to the best of my ability. Dr. Ivie Enebeli. Did I get that correctly? We also have Ikechukwu Oleka. Please come on. Up next is Gloria. Please come up. Is she here or is she online? Please come forward. Thank you very much. Then we have lastly Sandra. Alright, so I'm going to introduce each of them and read their bio as quickly as I can. I'll start first with Peter Oshikoya. Peter is the project coordinator at W Rescue. He's a community coordinator at Sickle Cell Advocacy and Management Service Initiative, SAM, an organization which caters for the needs of people living with sickle cell and their families through advocacy, awareness, education, medical and psychological support. I'm so sorry. Godwin, Idiovo. Please forgive me. Please give me cake for I beg you. Thank you. Alright, I'll have to quickly go back to introducing Peter again because we're recording it. So Peter Oshikoya is the project coordinator at W Rescue. He's a community coordinator at Sickle Cell Advocacy and Management Initiative, SAMI, an organization which caters for the needs of people living with sickle cell and their families through advocacy, awareness, education, medical and psychosocial support. Peter is a certified genetic counselor. The genetic counselor is a sickle cell warrior, advocate, and educator. He runs an online awareness and education platform called Sickle Cell Matters, where he educates and helps people living with sickle cell disorder to know and understand that there is life outside being a warrior. For more than 5 years, he held the position of the public relations officer for Luth Surulere, Sickle Cell Club, and Genotype Foundation. Peter holds a BSc in Accounting from National Open University of Nigeria and a certification in digital marketing. He has been learning about sickle cell for over 15 years. He was a volunteer with a sickle cell NGO for over 10 years and has volunteered for other sickle cell NGOs as well. Peter loves learning to improve his knowledge capabilities, to teach and improve others to becoming the best version of themselves. He loves to help persons living with sickle cell know and understand that there's life outside being a sickle cell warrior. His favorite quotes are, "You are not your genotype. You can live a healthy and optimal life despite living with sickle cell." So that's Peter Oshikoya, everybody. Next up, Ikechukwu Oleka, IK, or short. IK is a certified digital marketing consultant, a smart home automation expert, and a passionate blood health advocate. He works with IMA Health as a media and project coordinator to coordinate and execute projects and events and campaigns, which includes blood drives and donor recruitment in Lagos. He manages the various social media channels and the website database. He also lives with sickle cell and supports patients in need of additional support. He is passionate about the sickle cell awareness and breaking the sickle cell cycle. He has a Bachelor of Science in Education from the University of Benin. IK, everybody. Next up, I'll be introducing Gloria. She's an experienced clinical psychologist with over 6 years of professional experience in adult and child psychology. She's a trained CBT and DBT expert, mindfulness practitioner, and substance abuse treatment and prevention expert. Gloria owns a bachelor's degree in psychology from the University of Nigeria and a master's degree in clinical psychology from the University of Lagos. She is a member of the National Association of Clinical Psychologists, NACP, American Psychological Association, APA, and International Society of Substance Use Professionals. Over the years, she has shown competence in providing support for our clients by providing an empathic environment that focuses on the uniqueness of each client's problems. Gloria's areas of expertise are substance dependency rehabilitation, trauma therapy, couples counseling, family therapy, depression, anxiety, and mental health support. In her spare time, she likes to read, sing, and play. Hopefully she can do one of that for us. She's a lover of God and a devout Christian. She's married to Mr. Isaiah Peter. Gloria, you're welcome. So we're going to be introducing next Dr. Ivie. Enebeli. She's a medical doctor. She specializes in pediatrics. She's the founder of Little Cell of Mind Sickle Cell Foundation, LCOM. LCOM is a foundation focused on sickle cell awareness, providing support for both sickle cell patients and their families. LCOM is focused on mental wellness for sickle cell patients, as we understand how mental health can be easily overlooked in people with chronic illness. Ivie is an avid sickle cell advocate and is determined on achieving the mission of the Little Cell of Mind Foundation. Ivie, everybody, welcome. So next, I'll be introducing Godwin Idiovo. He's a nutritionist with specialization in healthy and sustainable eating for people with NCDs and sickle cell. He's a sickle cell advocate that is also interested in advocating for the use of nutrition as a form of management in sickle cell, and he's an LCOM Foundation member. Godwin, welcome. So lastly, but not the least, I'll be introducing Sandra. She's the lead psychologist at Inside Wellness Therapy, and she's also a lecturer. She's the founder of Psychebabble Foundation, a youth-led, registered not-for-profit organization in Nigeria, which was born to bring awareness for mental health in Nigeria for all Nigerians. Sandra is the convener of the Practicing Psychology and Mental Health program, tailored for young Nigerian graduates and undergraduates of psychology and related disciplines. Sandra. All right, very quickly, thank you everyone for joining us. Thank you those online. Thank you our panelists for being here. And please, as you're taking pictures again, I'll reiterate, kindly tag at Psychebabble Foundation and what's LCOM?
Yes.
Yeah, LCOM. What is it like living with sickle cell? Can you please see that?
Sickle cell, it's been a hell of a life. Yeah. It's been a hell of a life. You just know anything can be with that. Yeah. Even as little as we thought. When I say thoughts, there are some things you think about and you get anxious or you start to panic, like, you know, some kind of things you have to think about, like let's say you're expecting your results and you know that if you don't pass a certain course, you're not going to go to the next stage, you're not going to go to the next level. And you know you didn't really do well, so just the thought of that is already giving you crisis, because yes, you're already panicking, and then you're not supposed to panic because it's not good for your health. Literally everything is not good for your health. That's what living with sickle cell actually means. Actually, I got to know I had SCD when I got to school. Yeah. So all through my can you hear me? So all through my childhood, teenage age, and all, I had no idea it was sickle cell. Yeah. Actually, my parents do, but this thing with Christianity. They want their faith to be strong, so they didn't really say much about it. So it not look like they are faithless or something. Sorry. So they not like faithless or something. So they just kept it to themselves and just kept believing, okay, my genotype will change from SS to AA. So all this while, whenever I have crisis, yeah, that's what it is called. I don't know if it was called crisis then, but when I have this pain, it's always terrible, so painful. And normally, when you have this pain, you're supposed to go for admission. Yeah. But what they do then is they take bath.
Let me see.
Oh.
No, I'm fine here.
And they just start using hot water to massage my body.
I think I won't be able to get this.
That actually does make it better. It just gets the pain so much, and you just keep crying, and then they give you paracetamol to take, and then you just have to cry yourself to sleep. So that's how basically I grew up with sickle cell. I did a lot of crazy stuff when I was a kid because I didn't know, yes, I was not supposed to do that. Yeah, I played a lot. After playing, I ended up falling sick, I ended up crying. Next day, I go again to play. At some point, even going to do basic chores like fetching water, yeah. After carrying like 2 buckets up the stairs to the house, we just start crying, my bone, my leg, my hand. And they're like, what's happening, what's happening? Actually, they didn't really know it was the sickle cell. They just knew it was genotype. They didn't really know what sickle cell was all about and all. So it continued like that until I got to school. My 100 level clearance, it was so stressful and all normal. So, and I felt ill. I didn't know it was sickle cell crisis. I thought it was just malaria, so I just went, got malaria drugs. So I slept. While sleeping, I was so shaken badly that my roommate had to rush me to the health center. They did some tests, and then the doctor was like, I was like, genotype, what's genotype? Now, the crazy thing about this thing is they don't teach this in school. So you can't really say, I went to secondary school and I can say, okay, I know my genotype, except you have someone that can say, okay, do you know your genotype? Talk to you about genotype. But basically, most schools don't teach this. So it was kind of like new to me, like genotype was genotype. So I said, okay, here with that. What's this serious that you don't want to tell me right now? You say you're coming back. I said it's coming. Then he came with someone else and they gave me the whole lecture and everything that's happening and how it's going to affect everything I do, how I will have to take into those things before I choose what I want to do. Like before I decide to take the clothes I want to wear, if I decide to say, okay, I'm wearing this clothes today, I have to look at the weather, I have to know I should not do what will stress me, those kind of stuff. Then it was quite a lot to take in. It was quite a lot to take in because I was not expecting anything like that. This means I will now have to it was so much for me then to take it because I actually applied for computer engineering school then. I did my 100 level first. I could not finish it then, so the whole stuff just got me broken. I couldn't do anything. I just talked to my clearance. I just I just felt like going back home and I thought to myself, I go home, what's the essence? But then it was too late for me to continue with my computer engineering clearance. So I had to education, yeah. So it was the whole changing course, like knowing that I have sickle cell, living with sickle cell, it's life altering actually. But you just have to go and just know the do's and don'ts, know basically what's your triggers, know what you have to avoid, know what you have to take to be healthy, know your basic medication and all. Just know your do's and don'ts, I think. So living with sickle cell has been
Wow. That's a very, very interesting story. I mean, for most people that I've met, they're usually very aware of what is going on. Like, they know. So it's actually strange. I have never ever heard of anyone with sickle cell who did not know about it until you were already going to be an adult. I mean, how old were you?
I'm 17.
Wow. You were close to being an adult.
So it's crazy.
How did that affect you? I'm sorry, we're coming to other panels, but it's quite interesting. Did that affect your relationship with your parents in any way, knowing that they sort of eat? Was it that they were not aware themselves? I mean, you said something about it was just genotype for them. Was it that they were not aware of what having sickle cell disorder meant, or were they just faithing it that in Jesus' name every knee was bound, or what? No, I'm just trying to.
Okay, yeah, I get a question, but the thing is, they just know it as genotype. Most people don't know what it really means to have someone living with sickle cell. They just feel it's a genotype, like normal A and AS. A and A, there's nothing wrong with that. You can just say okay. But SS is like kind of special. It's different from the other genotype, but they don't know that way. They just feel, oh, it's a genotype. It's a bad genotype.
They didn't know the gravity of what it entails. So I hold on to that because I'm coming back to you, and this time you would have to explain to us what the whole thing is about. Because sometimes some of us, I don't know if there's anybody here who just thinks SS2 is a genotype, but if there's anything that we need to know in depth, you're going to talk to us about what the whole sickle cell disorder is and everything, now that you know better. Thank you very much. So I'm going to ask you very quickly, Gloria, what are some of the coping mechanisms, like for somebody like him who didn't even know that he had this kind of ailment growing up? I feel like finding out, that's very terrible. What do you think, and even for people who know it, what are some of the coping mechanisms that people can, people living with this disorder can do that can help them? And also, the other question that I'd like to ask you is also, how can maybe a parent bring this news? Some of us here might not be parents yet, but God forbid, or maybe we know somebody who is a parent, and you have needs or something or somebody that you want to help out. How do you think they can break the news to them and help them to cope and live with it?
Okay. First of all, in fact, I've always known that living with a chronic illness, sickle cell, HIV. I have a friend who has HIV, and I know how they have to deal with that. Has always been difficult. But hearing it from him, first-hand experience, it's a bit different. So coping with sickle cell disorder, I don't know if that's right, but living with sickle cell can be really challenging, like he has said. Well, I think the first thing is acceptance. Let's start from there, because the truth is, it's never easy to be told that, this is it. Sickle cell for me has always been a very scary thing to hear. I've had classmates from primary schools and all that had to go through that, and I just knew that it wasn't a good place to be, because you could really see them. It's not something that is hidden. You could see their struggle. And right now, as an adult and a psychologist, I do addiction treatment, so I've had to deal with clients who got into their addiction because of having to deal with sickle cell medications and all that. So I know it's not something that is very easy, but the first thing is acceptance. Because for him, like he talked about when the doctor told him that he had sickle cell and all that, there were some changes that he needed to make in his lifestyle. So the first thing is sometimes when people do not even accept that, like when we are fitting it, for example, God forbid, it's not my portion, I don't have this. It makes it more complicated because you are not living the way you should be living. Now, let me use diabetes. I'm going to use diabetes because it's something that is very common. So people living with diabetes, for example, someone who is living with diabetes, you know that there are certain foods that you can't eat in excess. You need to live a certain kind of lifestyle. There are medications that you need to be taking. Same with people living with mental illness or anything like that. But if you don't come to a place where you accept that, okay, this is it. I've been diagnosed with this, and this is it, and I have to live in a certain way. It's going to really affect everything because you may just go about being careless about what you eat, where you go, or what you do not do. So the first thing is accepting that there is that. And the good news is, in recent times, there have been a lot of researches and new ways people are able to live. I've met someone with 45 years, someone around 45 years who was living with sickle cell. When I was younger, people used to say that you don't live past a certain age. But these days, we're getting older people, living with sickle cell. So understanding that I have this disorder, I have this illness, this is it, it's chronic, and it just kind of changes everything for you. This is it. It doesn't need to define everything, even though it only puts you in a place where you are more aware and you are managing your everyday lifestyle. So that's going through or how difficult it is, right? We may not really understand. I'm a therapist, I deal with people with chronic illness, but I don't have a first-hand experience. I can only say based on the experiences of everybody that I have met. And we all know that everyone's experience is different. So how this person is coping with it may be different from how the other person is also coping. So understand that it's difficult, but there are actually there's a way out of it. Okay, way out of it being that there's a way you can manage yourself, there's a way you can live your life and lead a productive and healthy lifestyle, even with the illness. And then knowledge. Have you learned about this illness? Have you learned about how you can live? How do you manage yourself? You need to get that information. When you find your place in it, it's a new reality. When the friend I talked about HIV, when he told me that, oh, Gloria, first of all, what happened was, I think how I found out was, I posted this anonymous message, or there's this funny thing we do on WhatsApp where you post that, you send me an anonymous message. People were sending messages, and someone sent me a message like, Gloria, you're a nice person, I really want to be your friend, but I have HIV, and you don't deserve that, you deserve something better. And I was like, this person is just playing pranks, because actually people were sending all sorts of messages. And later, after like a month or 2 or 3 later, he sent me a message that, Gloria, this is it. I was the one that sent you that message, but I just wanted to tell you that I've been declared undetected, meaning he couldn't transmit the illness to someone else. And I was like, wow, are you serious? So all this while we were friends for this long, but actually you had this, but you never said it to me. And I was like, well, this is how I was coping. Now for that person, one thing I learned from his case was he believed, he knew that this was who I was, and he knew that he needed to take his drugs, he needed to do certain things, live a certain kind of lifestyle, which actually brought him to a place where he's undetected. This my friend is getting married. In fact, I had his traditional marriage like 3 weeks ago, and he's getting married now. So that's it. So the first thing is, this is the illness. The second thing is, what knowledge do you have about living with this illness? I'll say in his case, maybe it's God, it could just be something, maybe it happened or something, for him to have lived up to that point without even knowing what was going through. I'm sure that after you got the knowledge, it was a bit different. right? Because he's now aware. Knowledge, they say, is power. So your awareness will help you to then move further to knowing the right things to do and not to do. Then for your mental health, still all these things, basic things like knowing that seeking for help when you need them. Because you don't need to, because sometimes, like when we watched the depression video, the guy was saying, oh, you had to go through a lot, and you don't really need to go through these things on your own. Sometimes when we go through challenges, when we have difficult times, we just feel like it's my problem, like you own it, like it's my problem, I have to carry it alone. You really do not need to carry it alone. So if you need help, it's okay to ask for help. The good thing is, you can ask for help from maybe find the support, find other support, because you're obviously not the only person going through sickle cell in Nigeria. So get support from people that have information, maybe professionals that understand, that can help you go through that, families that care, that support, can help. Then basic coping skill, like maybe exercise, maybe nothing so difficult, nothing too stressful, but basic exercise you can do, something you could do to release stress, because going through sickle cell can be a bit challenging, and there are a lot of stress and all that you get to face. What do you do? What are your stress coping mechanisms? And of course, as much as possible, avoid negative coping strategies, because a lot of people get into using substance or doing other things that might be counterproductive. So instead of actually helping you, just makes it worse. Then for the second question about how to, maybe I don't wish that for anybody, parents, become a parent dealing with that, because I know it's really not easy and it's difficult. But if you have loved ones or people that have children or family members, relatives that are going through this, I think first of all, the first thing is just be empathetic. You may not understand. First of all, you don't know how they are feeling. You don't know how it is. So don't think that you know, because you may just have an idea. Except you are there, you don't know. So you need to be empathetic. You need to know that it is not easy. It is difficult. It's actually difficult waking up. The way I see chronic illness is there's a lot of uncertainties. The uncertainties of, will I live? Will I die? How complicated can this get? Does it get better? When is the next? You might not even be having a crisis, but the thought of, will I have a crisis? It can put people, it can really affect mental health of anybody, come with anxiety. Research has shown that chronic illnesses are a leading cause of depression and all that. Because of that, it kind of puts, when she gave the analogy of sitting on a chair that is not neither here nor there, the person is constantly on the edge. So you need to understand that this person is going through a lot. He's going through a lot, and be empathetic. If you don't know how to communicate, maybe get a professional to communicate to this person. It doesn't have to come from you, right? But as much as possible, even when communicating, you need to help. You need to provide the support that the person needs, because it's not enough to just tell someone this is what you're going through and all that. You should be willing to let the person know that there is hope. Instill hope. Whatever you are saying should be able to instill hope in that person and be there to support.
Thank you very much. Thank you very much. These steps take note of, okay, these are the things that you should probably take, these are the things you should avoid. Because I know that as soon as IK found out that this was what, there was a significant lifestyle change for him. So now that, okay, I know this is what I am living with, what are those lifestyle changes that people can make, especially with respect to diets, that can help them to live better, cope with? That's it.
Firstly, everyone with sickle cell experience food or diet separately, differently. For me, I can't take sugary things. I have seen sickle cell people living with sickle cell can take some sugary things. I can handle some of it. For people living with sickle cell, basically, if you want to go on the diet, it's just like any regular person going on the diet. So you avoid the sugar, high fat foods, high calorie food, high sugar foods and high fat foods. your Coke, Fanta, all those things. For some people can take it, sharp. That's what I was explaining. I started with sugar. Some people can take Fanta, I cannot. But take your vegetables. A lot of, I've seen, I had a session on LCOM one time, and I was talking about vegetables, and there's a guy there. He was like, he doesn't like vegetables. So I was like, you live with sickle cell, okay, fine. Even as an adult, you should like vegetables. Why wouldn't you like vegetables? So you take your vegetables always, and your fruits. Every time you should take your fruits. Living with fruits, and how would I your fiber. Fiber is very important too. As much as you take your water, you should take fiber. Fiber helps now for balancing our blood sugar, it helps with blood flow and everything. It helps to absorb sugar, to excess sugar from the body. Yeah, so it will make you have less triggers. So if you take too much sugar, you have more triggers. So that's why you need your fibers. And fiber can be gotten from either your oats, your grains, convert from vegetables. So that's why I emphasize on vegetables. And mainly always take water. Like enough. There can never be enough amount of water you can take as someone living with sickle cell. You have to drink water every time. And yeah, that basically it's just eat well, eat healthy, and take care of yourself. Because you know your triggers. Some people just know your triggers. So that's another thing I mentioned in my webinar I had. Know your triggers. For me, it's sugar. For others, it can be anything. It can be spice. It can be hot food, cold food, whatever. Just know what is good for you and what's not good for you. First of all, you know your body. Then once you know your body, you know what is not good for it. Because if you just go out taking everything with you, eating cold food, and when you know cold food affects you, it's terrible. It can cause trigger and crisis immediately. Yeah, so that's basically it.
Thank you very much. Thank you, Godwin. Alright, Sandra. Okay, I'm going to ask you, I don't know, how do I put it? So would you say that therapy offered to, you're a psychologist yourself, therapy offered to clients living with chronic diseases is different from the therapy offered to typical people? Typical people. Is it different?
Therapy offered to people living with sickle cell, it's just like asking, I don't know how to place it, but not quite, right? I've had, working with LCOM, last year we provided free therapy sessions for a couple of people within the LCOM community. So I know that some of the clients that I've worked with, it's pretty much the same thing that they're coming into sessions for. It's anxiety, it's a depression with living with a chronic illness. It's the same way somebody who, I don't know, you're feeling sad about something, or you've experienced, say grief for example, let's use grief. You've experienced grief, you lost a friend. Someone living with sickle cell could also be experiencing that grief. Maybe they lost a friend who also lives with sickle cell. They are coming in, it's just the context is a tiny bit different because they are living with this illness, and now it's the thing of, I lost this person. Every time I'm constantly worried, am I next? What's going to happen with me? What's going to happen to me? Things like that. But it's pretty much the same thing that happens in therapy with everybody else. I think the other issue that people living with sickle cell come into therapy with is the stigma. So I've had somebody in therapy tell me that somebody told them to their face, because you're SS, I cannot be friends with you. And that is hurtful. And they told this person this as a child. And that is hurtful. Imagine you being a child and you're coming to play with your friend, and then they say, sorry, I cannot play with you because you had SS. That's hurtful to them, and they've been carrying this pain since growing up. It's impacted the way they live, it's impacted the way they make friendships, it's impacted their relationships with people. And now that begins to affect their own way of living as a person. So you realize that it's the same thing that you go through that they go through. It's just that in some other ways, it can be a lot more
intense than for other people, but it's pretty much the same thing. The same thing that brings people to therapy, the same thing that brings people living with sickle cell.
So I think that just tells us that they're human beings just like you. I mean, it's just that they have some sort of ailment that helps them to experience things differently. But they have 2 eyes. They don't have arms on their head. I mean, you should treat them the way you treat a human being. So I feel like she said, empathy is so important, and kindness. Come on, it costs nothing to be kind. It costs nothing to be kind. I don't know if we've gotten this sorted out, so we can have Dr. Ivie, because my next question is for her. Can you just say hi, Dr. Ivie? Just be sure that we can hear you. Hi. Okay, is it better?
Yeah,
So we all managed to strain our ears. Empathy, have you? That. Have you had any weird situations with sickle cell and people who are deeply religious? Like, they wanted to faith it, and their faith in it was also from a place of ignorance. But have you had people who knew the gravity of what they were experiencing, but will still not do certain things because, I have faith, I believe I am whole, I am healed, but they have this experience, they are still having these issues. And how do you deal with it? Coupled with, aside from religion and sickle cell, what are some of the other experiences you've had, like very weird experiences you've had at, being at LCOM? Yeah.
When you talk about religion, since you're reading any chronic disease, I think it's quite kind of be a bit of a sensitive topic, just because some people are religious in the way that, I can have, for instance, someone has maybe that religion or something like that, and you're religious in the way that you want to take medications because you have faith, you are praying, and
To come to that, I had a question of love and sickle cell. How do you combine that? Well, please hold that. I'm going to come back to you or to any other person in the panel. But yeah, I'm coming back to you actually. Ivie. You want to talk? Yeah, the three of you are actually going to talk about your experiences with love and sickle cell. You do that. But I told you I was going to come back to you for to tell us. So you can just do both together. You can tell us what tell us what the disease is about, so that if there's any one of us here who has a friend, we need to learn to know how to. We don't want to be the people. Like none of us should come out of this place and treat and stigmatize consciously or unconsciously anybody with sickle cell by what we are doing or what we are not doing. So we want to know, what is this disorder about? How can we help every one of us in this room? What is it that that if somebody could do for you will go a long way? Sometimes we don't feel the pain with you. You don't know what it's like. But what can we do for you that will communicate empathy? So I want you to tell us what the disease is about, help us know that, and you can as well share your experiences with love. And then I'm going to ask Dr. Ivie and Godwin as well. So I'm going to come back to you.
Okay. Before I go into all that, I want to quickly say something about religion and the sickle cell. Someone said religion is it's so control people, and I think I agree with such person, because in my course of volunteering with sickle cell SCAP, I volunteer with Sickle Cell AIDS Foundation. We've gone on several rescue missions. That's why I call it rescue mission. There are cases where a child is having a crisis. The child is supposed to be in the hospital on medication, taking treatment. We are taking the child to a church. You're keeping the child there on the altar. You're saying the child has to be there because my God will come and answer and heal my child. And your child is screaming in pain, and you're still saying, my God will come and answer. Like, I don't understand. Like, religion is just messed up, because there was also another instance where a young girl, she has crisis as well, and you took her to a church and you started plugging her with boom. Why? You want to plug out the disease out of the person's body. It's just so crazy. Things you will hear, things you've seen for yourself. I've seen a lot, I've heard a lot. Because of volunteering. So it's really crazy. It's really crazy. Then coming back to the question, what's sickle cell and all about sickle cell? Okay, sickle cell is a blood disease. Basically, your red blood cell is circle in shape, so everything flows easily. But in the case of sickle cell, it's like C-shape, like a sickle. So most times when your blood flows, it gets clogged because of the hook shape, C-shape. It gets hooked up on your veins and then gets blocked. And whenever it gets blocked, it is also crisis. So that's why, like I said, you have to take a lot of water to keep flushing out the veins, a lot of water constantly. So that's what basically what sickle cell is all about. Now, when you have such crisis, the next thing you have to do is take your medication, depending on the level of your pain. So you have to know your level of pain. If the pain is mild, then you can just, okay, I can sit at home and take my pain medicine and then try to get rest. But if the pain is severe, then you have to go for admission immediately. That's basically all about sickle cell. Then you have to take your medication daily. There are some basic meds you have to take every day. Something like folic acid and B-complex, your blood tonic, vitamin C as well. Those are your like basic meds. You have to take them every day. You just have to just say, okay, this is my life. I have to really take this every day. It's not easy, honestly. There are some days you just want to just say, have I not been taking this thing and nothing is happening, and you just keep it. But then it's just like a little drop of water. So you just keep. You don't get better, but their effects is making you kind of healthier. So that's the whole part of taking them basic medication. Then eat healthy, like I said, a lot of vegetables, a lot of greens. Like your whole diet, everything just changes. Like me, I'm the kind of junk person, so then I used to take a lot of junk. So then I just have to get used to the fact that yes, this is going to be a crisis in me. There are some kind of snacks I take, and I start having heartburn and then crisis. So I have to like, it took time, honestly, it took time. Everything is a process, so it took time for me to like get used to this fact and accepting it, like you said. There's one thing about knowing, and then there's another thing about accepting, and then implementing such knowledge, because yeah, different things entirely. You can know and then decide not to go ahead with it. You can just know and then that. But then that's just basically living with sickle cell. You just have to know your triggers as well. Like he said, you have to know your triggers, know what works. Know your body, basically. Know your body.
Okay, so I just quickly wanted to add something to what he mentioned. Remember you asked the question about things that bring sickle cell patients into therapy. Something important is okay. So you mentioned taking your medication and all of those things. Like Gloria mentioned also, addiction is a very big part of sickle cell disease. Why I've had people, I'm not an addiction specialist, so when most of my clients come into therapy with addiction, I usually refer them, but it's something common. Why? Because of the pain medication they are given. So sometimes the pain becomes way too intense than they budgeted for, right? And then you're in the hospital, they are pumping you with so many pain. Okay, you're in the hospital with a crisis, and then you're shouting every 1 minute or every hour. And we know how the health system is in Nigeria. The nurse can come and say, you have started again, or you take jack, and they go. Things like that. Sometimes it's so easy for them to get addicted to the pain medications. And we all know the plenty effects of addiction, which is a different ballgame entirely. The other thing I wanted to talk about is the, talking about it. So one other issue that people I've worked with who live with sickle cell, one other issue I know that they have the most is community. So you hear people talk about how, see, I cannot come and be bothering everybody around me. What do they want to do? Do you get? So they are more worried about, if I tell this person, they'll just tell me, oh sorry, and then they move on. And I don't want to hear that. They don't want anybody feeling sorry for them. Can you actually help? Do you want to raise money for me to get bone marrow transplant? What do you want to do about it? But the truth is, we all need community. That is one thing I know for certain. We all need community, and I'm so thankful for LCOM. Since we started working with LCOM last year, it's been amazing. Last year was, one of the times I had a lot of people in my practice with sickle cell, and it was really amazing because people are like, I don't get to talk about this as much as I want to, and here I am with this safe space, to talk about it. And then they go home after the session. Tomorrow you get somebody booking in for a therapy session, and it's also someone living with sickle cell. So you kind of refer people, and then it makes you realize that these people do not have the community that they truly need. I understand it can be difficult for as many people who may be living with sickle cell. I understand it may be really difficult to talk to people about it and seek help and all of that. But it's important. There are a lot of people who, say students who are living in hostels or living in their own apartments with other people, and their roommates don't even know that they live with sickle cell. And then something is wrong with you, and your roommate is like, she played for one like this. Do you get? Because they don't know what's going on. You didn't tell them. But it's really important that you do. They need to know what's going on. In that case where your friend carried you on his back and moved you to the hospital, imagine if your roommate had no idea. Right? So you just be there wriggling in pain for so long. Nobody to help you out. Yes, I understand that sometimes people can be a mouthful. These days everybody speaks to whip up their phone to make a video of somebody when you're in pain and all of those things. But again, you have to take that gamble. You need to, I think Gloria was the one who mentioned it, that you need to be cautious of the people that you talk to at least. But if you are living with somebody and none of those people around you know that this is what's going on with you, then there's a problem. And sometimes I don't blame people who live with sickle cell with this, because it's the experience they have. It's people around them before that have made them shy away from telling other people that this is what's wrong, this is what's going on. So if you as a person, someone comes to you and tells you that they live with sickle cell, and then the first day you see them in crisis, first of all, you are hit with so much shock. You don't know how to respond. tomorrow they're in crisis, you are still the same way, you're not responding, you're not doing anything. The next day they're in crisis, you're still not doing anything. Obviously, the next time they meet somebody else, they may not open up because the last person I opened up to didn't say anything, didn't do anything about it. Yeah, so that's it. Ivie had mentioned, he knows his triggers, he has sat his friends down and educated them on this is what's going on, this is how it is for me, so this is what I need when I'm in crisis or something like that. But yeah, that's just what I wanted to add. And it's no shame to seek help when you can. It can be difficult and overwhelming to carry all of this pain and burden all by yourself, but there's no shame in actually seeking help. When you need to, LCOM provides support, both mentally, but financially.